Hi, just going to talk today a bit about aftercare and how important that is if you are considering having any procedure. There are two aspects to the aftercare that you need to look out for. One is the absolute terms and conditions that are offered, and oftentimes you'll find that this is not clearly displayed about what is exactly covered in the aftercare. So I'm going to outline exactly what we offer here at the STAIANO clinic in terms of our absolute terms and conditions in that respect. All patients, when they're having a surgical procedure, are covered for 30 days for any complications. That means any infection, hematoma, any problem that occurs in the immediate post-operative period in the first 30 days after the surgery, that will be addressed if they need to go back to theatre or if you need an extended hospital stay, anything like that, you will not have to pay if it is for a medical complication from the surgery. And that gives you peace of mind that things will be covered for the first 30 days. On top of that, there is a guarantee, if you like, or a warranty in terms of revision surgery, which is a little bit different because that's more talking about things that you may not be quite happy about. So if the scar's not quite right, if there's a dog ear, a little bump at the end of the scar, if one implant's sitting a little bit too high, or if you get a problem like that, then that's covered. And that's covered for 6 months at BMI hospitals, which is the Priory hospital that I work at, and for a year at the Parkway Hospital in Solihull. So for that period of time, you are covered. If you need any surgery, there will be no cost. If you need any revision surgery as a result of your operation, then I will fix that for you if it's within that time frame. On top of that, I often see people giving one post-op appointment included in their packages. Now here at the STAIANO clinic we give you unlimited post-op appointments. In fact, I always actively encourage people to come back to the clinic because I want to see how you're getting on. So you never have to pay for follow-up appointments, and that is whether it's a week, a month, a year, 5 years. We encourage you to keep coming back because we want to see how you're getting on and how things are settling. So you never have to pay for follow-up appointments, and that's before and after surgery. We do charge for the initial consultation, but after that initial consultation, if you want to come back again, we encourage you to come back and go over things as often as you need prior to surgery, and you'll never have to pay for those consultations. On top of this, you need to think about if you're having an implant which will in itself have a warranty. And so this is where it gets a bit complicated because all the makes of implants have different warranties. All the implants we use here have got lifetime warranty. That means that if they rupture, if the shell fails, a new one will be provided. But there's lots of nuances around the warranty. Some will allow you to have both implants changed. Some will allow you to have a different size of implant changed if you need a different implant. And some will give you money towards the hospital costs because obviously they're just covering the implant. So if you need to have the implant changed, if it's outside that 6 month or 1 year, then you'll need to pay the hospital cost, which can be considerable. So some will give you money towards that. And then some will also cover capsular contracture as well as just failure of the implant. So you have to look at the make of implants, and certainly I can give you the full warranties for the makes of implants that we use, but this is something that you really need to look out for. The other aspect of aftercare that I would say that you need to think about is not only the absolute terms and conditions, but how that aftercare is delivered. And that really is something that you only know once you've had to use it. It's like insurance. You only know when you claim whether actually it's a good company or not. And that sort of thing that I would suggest you get a feel from what people are saying. And that means you have to get out there, look at what's being said about the service, to see that your surgeon or your practitioner or your clinic, to see if they're treating people well, and make sure that they're looking after people. It's certainly something that we work hard to do here, and one of the things that I make a feature of, that one of the reasons I set up my clinic was so that we could look after people, and I would very much hope that that's the message that my patients are given, because we really try to make sure that you're looked after and you're nurtured. And it's not so much about whether you need revision surgery, because fortunately revision surgery is very rarely needed. It's more that you're looked after, and that if you are worried about things, most things settle. Often things look a bit strange in the first week or two. Things can look not quite the way you might have expected it, and it takes time for them to settle. And so you need to be sure that your surgeon or your clinic's going to be there for you in that time and walk you through that process and make sure that you get the outcome that you want. And if you don't get the outcome that you want, then they're going to look after you and do everything they can to give you that outcome. So comes down to what I always say, which is do your research. It's your body. Make sure you're happy with everything that's being said to you and how you're being looked after. And there's plenty of people offering the service out there. So if you're not quite comfortable, get a second opinion. And there's absolutely no problem with that. And as a surgeon, I appreciate that lots of people do get second opinions. And in fact, I encourage it. I think it's good to get a second opinion. It's an important decision, and get as many decisions or opinions as you need and feel comfortable with. So I hope that's cleared things up a bit from our point of view. Do your research, and if you have any questions, by all means get in touch with us, and I'll be more than happy to elaborate or clarify any of those points. Thanks very much. See you soon.